Hello again, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. We're going to talk about liposuction. Before we get into the power devices like tickle and micro air, we have to understand manual liposuction because that's really the foundation of everything we do. Manual liposuction is exactly what it sounds like. There's no motor, no vibration, no assistance. It's just the surgeon, the cannula, and suction. A cannula is a thin, long, hollow rod with holes at one end and suction or vacuum at the other end. You're physically moving the cannula back and forth to break up the fat, aspirate it or suck it out, and most importantly to sculpt. And honestly, this is where you develop your skill because manual liposuction actually gives you the best tactile feedback, meaning you can actually feel the tissue planes, you can feel the resistance, and you can feel when you're too superficial. Now, the downside of manual liposuction, it is tiring, it's slower, and in large volume or very fibrous cases, it's just not efficient. But for fine contouring and finishing work, manual liposuction is still incredibly valuable. Let's move to the powered liposuction, starting with tickle. Tickle liposuction uses a high frequency vibration of the cannula. So instead of the surgeon doing all of the work, the device helps to break up the fat as you move the cannula. And what that does is it reduces effort, it allows a smoother motion of the cannula and less trauma, and it makes the experience much more comfortable for patients, especially if they're awake patients. And that's actually where the name comes from. Patients literally describe a tickling sensation during the procedure. So where does this shine? Tickle is great for awake liposuction, small to moderate volumes, and more superficial areas like the chin, the arms, or the lower abdomen area. It's a controlled procedure, it's gentle, and it's very patient-friendly. Now, let's talk about micro air, which is really the workhorse. The micro air uses a reciprocating cannula, meaning it just moves forward and backward very rapidly. And that motion allows for a much more efficient fat disruption. So instead of just gliding, you're actively breaking through the tissues, especially the dense and the fibrous areas, or if the area has been liposuctioned before. This is really where micro air excels. Think of areas like the back, fibrous gland tissue in gynecomastia, revision liposuction or liposuction before, large volume cases. It's faster, it's more efficient, it's more powerful, and it really reduces the surgeon fatigue. Now, can you use it for precision? Absolutely, but that depends on the surgeon because with more power comes the need for more control. So how do we think about all three? Think of it as a spectrum. Manual is about the control and the feel. Tickle is about the comfort and the smoothness. And micro air is about power and efficiency. And the biggest mistake people make is thinking that you have to choose one. You really don't. The best surgeons use all three techniques and devices depending on the case. Now, you might start a case with micro air for bulk removal, and then switch to tickle for a smoother contouring, and finish with manual for fine sculpting. Or you can do all three with one device. At the end of the day, it's not about the device. You can have every piece of technology in the world, but if you don't understand the tissue planes, and you don't respect the superficial layer, and if you don't have good technique, you won't get great results. So remember, the tool matters, but the surgeon matters more. I hope you enjoyed this talk. Please like and follow.